Assalamu alaikum. It's a series of videos regarding gastroenterology. I would like to discuss about the what intussusception. Okay, what happens in intussusception? In intussusception, like telescoping of one part of the colon into another. That means ileum telescopes into the cecum. Ileum telescopes into the cecum. There may be pain, obstruction, edema, and there is compression of the blood vessel, maybe bowel ischemia, as this portion is telescoped, so there is ischemia and thus rectal bleeding may happen. So intussusception risk factor may be recent viral infection, like those those kids who are getting rotaviral vaccination, they may got these. Pathological lead point, there may be Meckel's, maybe HSP, Henoch-Schönlein purpura, there may be celiac disease, there may be Henoch-Schönlein purpura, there may be celiac disease, there may be intestinal tumor and polyps. So again, HSP, Meckel's, celiac disease, intestinal tumor and polyps. You have to think these things. There is sudden intermittent abdominal pain. There is sudden intermittent abdominal pain. There may be current jelly stool. There may be sausage shaped abdominal mass. And lethargy and altered mental status may happen. Diagnosis. In ultrasonogram, there is a target sign or two concentric circles on ultrasound. In X-ray, there is crescent sign in the right upper quadrant, which represent the intussusceptum projecting into the large bowel gas. Treatment is here or saline enema, surgery if enema reduction is ineffective, if a pathological lead point is identified, or if the patient has a signs of perforation. An intestinal emergency most common in children. In an intestinal emergency is most common in children in 3 to 6 months. So 3 to 6 months. The ileocholic junction is most frequently included. Ileocholic junction most frequently included. Although ileocholic junction is normally located in the right lower quadrant, the invasion of the ileum into the colon often causes the mass to be found in the right middle and upper abdomen. Pathological read point is recurrent intussusception, atypical age, atypical location, and persistent rectal bleeding. Intermittent contraction of the telescope bowel during peristalsis results in classic presentation of the episodic inconsolable crying with leg flexed and drawn into the abdomen, followed by asymptomatic period. Abdominal X-ray may be performed to exclude intestinal perforation. Intestinal edema, bleeding, often associated with HSP, can form a lead point into the intestine to telescope into the adjacent bowel wall. This is the picture. Ileum. This is a colon lumen wall. This is a colon wall. This is the target sign. These the according to this ileum telescopes into the cecum. In here, this ileum telescopes into these colon wall or cecum. This is the target. This is the crescentic sign in the right upper quadrant. This is intersusception in histology. Appendix, ileocecal junction. Now, Michaels. If you talk about juvenile pole, children 2 to age with painless rectal bleeding. In Michael's article, very high yield topic. It is rule of 2% presentation often by the age 2 is to 1, location 2 feet from the ileocecal valve, maybe asymptomatic, painless, lower GI bleeding and anemia. Complication intersusception volvulus and intestinal obstruction. Intersusception volvulus, intestinal obstruction. Symptomatic patient surgical resection to prevent further bleeding or complication. Intersusception volvulus and intestinal obstruction. This is Michael's. Malnutrition of the midgut can cause bloody stool due to intestinal ischemia. However, of affected neonates are ill appearing with bilious emesis and poor appetite. Bilious emesis and poor appetite. Malrotation with midgut volvulus, failure of normal embryonic gut rotation, failure of normal embryonic gut rotation. There is narrow mesenteric base allows to increase small bowel mobility, twisting of the small bowel around the supramesenteric artery. There may be gut ischemia and necrosis. Most common in infancy, usually age less than 1 month. Acute bilious emesis, acute is bilious emesis, abdominal distension. Chronic is intermittent abdominal pain, vomiting, failure to thrive. Untreated hematochezia, peritonitis, and shock. Failure of the embryonic gut rotation, embryonic failure of the normal embryonic gut rotation. Diagnosis abdominal X-ray with or without dilated bowel, air fluid level, pneumoperitoneum. Upper GI series should be done. It's a gold standard. There is duodenal bird big or corkscrew appearance, duodenal bird big or corkscrew appearance, ligament triage on right, emergency laparotomy to relieve the volvulus, LAD procedure to reposition the malrotated bowel. Bilious emesis in infant can be due to severe etiologies like intestinal atresia, midgut volvulus, or spunk disease, meconium ileus. Initial management is clinically stable patient includes cessation of the enteral feeds, nasogastric tube decompression, administration of the IV fluid and abdominal X-rays. This is the picture of the midgut volvulus. There is corkscrew appearance of the small bowel volvulus. Contrast in esophagus and stomach. Contrast in esophagus and stomach. Corkscrew appearance in the small bowel volvulus. And this is sigmoid volvulus, sigmoid colon redundancy, usually from chronic constipation, elderly age, colonic dysmotility, especially hypomotility. Underlying neurologic disorder. This is high health. Sigmoid volvulus can happen due to neurological disorder. Slowly progressive abdominal discomfort with or without distension. There may be obstructive symptoms like nausea, emesis, and obstipation. Abdomen is distended, tympanic to percussion. X-ray is dilated, inverted, U-shaped loops, coffee bean sign. There is coffee bean sign, and volvulus is dilated, inverted, U-shaped. CT scan dilated, sigmoid colon and mesenteric twisting. There may be whale sign, there may be coffee bean sign, in X-ray coffee bean, in CT whales and endoscopic detorsion. These flexible sigmoidoscopy should be done. Endoscopic detorsion via flexible sigmoidoscopy and elective sigmoid colectomy. Emergency sigmoid colectomy if perforation or peritonitis is present. If perforation and peritonitis is present. If perforation and peritonitis is present. Cecal volvulus is the second common form of colonic volvulus after sigmoid volvulus and occur when the cecum and ascending colon twist on their mesentery. Progressive abdominal pain and distension along with nausea or vomiting are typical. Although constipation and advanced age are risk factors for both types of volvulus, patients with cecal volvulus tend to be younger and often report prior less resolving episode because many have congenital mobile cecum. Mesentery fail to fuse with the parietal bedroom. Abdominal X-ray may be revealed in cecal volvulus large dilated colonic loop and abdominopelvic CT scan is typically performed where world sign is seen. Treatment is endoscopic detorsion by phlegma. A endoscopic detorsion in here endoscopic detorsion is not advised, but sigmoid volvulus there is endoscopic detortion or flexible sigmoidoscopy should be done. In here, cecal volvulus, emergency laparotomy and resection of the volvulus colonic segment. Ileocholic intersusception, prolapse of the ileum into the colon, cause self-resolving abdominal pain and vomiting. In paralytic ileus, there is intestinal obstruction due to dysfunctional peristalsis. This is toxic megacolon causes colonic dilatation of the X-ray. However, diffuse dilatation of the colon with its normal anatomic arrangement rather than single dilated colonic loop in cecal volvulus. In here, toxic megacolon, there is uh, diffuse dilatation of the colon in its normal anatomic arrangement. This is cecal volvulus dilated air filled loop of the colon, normal descending and sigmoid colon. This is cecal volvulus, this is sigmoid volvulus, inverted U, coffee bean shape, cecal volvulus, small bowel obstruction on the X-ray, air fluid level, severe constipation, and this is the large bowel, colonic dilatation. This is a diffuse colonic dilatation. In the paralytic ileus, there is gas-filled loop on the small intestine. Paralytic ileus, small bowel dilatation, large bowel dilatation. Mm, That's all about this. Hope you enjoyed.